So this session is all about you, your FMG journey. Excellent question. Let us now deep dive into your preparation strategy. So how did you divide your time between videos, notes, and GTs? And how many hours a day were you studying? What was your revision strategy? So what's your take
Yes.
on this? How should one go ideally about this exam?
If you focus on just on the exams, as you said, 6 months is more than enough. If you have your concepts clear from the beginning, 6 months is easily doable. You can clear the exam in 6 months.
Okay.
But I would say that you need.
So to all those who are planning for upcoming exams, what are those things that according to you they must avoid? Any mistakes of yours that you don't want them to make. Online platforms versus offline coaching centers. So what do you prefer, and I mean why?
After looking at the videos, then I used to go through the notes, and then you need to solve the same MCQs related to that topic. That's how I was doing it. And
So hello everyone. Today we have with us my very good friend, my colleague, Dr. Bhargav Ganapathi, graduated from Shandong Medical University. We both graduated from the same university. He happened to clear the toughest FMG ever conducted. And you guessed it correct, it was FMG August 2020, and the passing percentage of that exam, as you very well know, fell to around 8%. So, Dr. Bhargav, a very warm welcome to you.
hi Ekansh.
Yeah, hi, how are you doing?
Good. How are you?
Yeah, long time no see, huh? These 2 years have been
Yeah.
very tough.
Indeed, true. That's right.
True. So, Bhargav, this session is all about you, your FMG journey, your mistakes, your strategy. It's a know-all interview, so be as frank as you can. Don't worry about the time limit. We shall begin. Okay, I have been asked so many questions from our juniors and other juniors and other colleagues as well. So we'll try to help them out as much as we can, as we always used to.
Sure.
All right.
Definitely.
So before we begin, can you please briefly tell us about yourself? I mean, what are you currently doing right now?
Yeah, as you already introduced me, we were classmates at the same university, so you know me very well.
Yeah.
And let me start off by saying that I congratulate you for passing the recent exam.
Thank you so much. Thank you.
Yeah. And recently I completed my internship at Victoria Hospital in Bangalore. So I cleared my FMG in August 2020, and then I started my internship after that. 1 year of clinical rotations, and recently I completed it. So now the next step would be appearing for the NEET PG exam.
So
started preparing.
Yes, I remember some of the PrepLadder teachers telling that exam was a hell of a skull buster. August 2021. So I remember that exam by that way. So and hence the session today. So Bhargav, when did you start your preparation for FMG, and how did you start it?
Okay, so if I have to say, just preparation for the FMG, it was like about just 3 months before the exam. So the exam was in August, and if I have to tell seriously, when did I start preparing? That would be sometime in June or something. So basically, just had 3 months to prepare. But 3 months is quite sufficient. Like if you know your concepts from before, like from your first year of MBBS, and you kept studying from before, get all your concepts right, and then 3 months is sufficient to clear the exam.
Okay, and how did you go about it at first? Thing you did?
So then back then I had taken PrepLadder subscription. So I had taken the video subscription as well as the question bank, and I just stick to one source. so I don't get confused looking at multiple sources. And I think that's a very important thing which everyone should do. Rather than looking at multiple sources, they need to stick to one and continue with that and finish that.
That is important, because these days there is a lot of confusion, about so many platforms, so many resources, what to do, what not to do. So Bhargav, there is this confusion among students. Like some students are being told that you already, I think, gave a kind of answer to that, but I would like you to elaborate with this one. Some students are being told that you just need 6 months to pass FMG or next screening. Some people say start from the last semester or your internship phase, and some say no. Some belongs to the school of thought that you must start the prep right from the beginning, from the first year. Basically, I think they mean to say maybe you start studying or kind of that thing. So what's your take on this? How should one go ideally about this exams?
If you focus on just on the exams, as you said, 6 months is more than enough. If you have your concepts clear from the beginning, 6 months is easily doable. You can clear the exam in 6 months.
Okay.
But I would say that you need to start studying not for the exam, but you need to get your concepts right from the first year itself when you get into medical school right away, so that it doesn't become a huge burden for you in the last 6 months or 3 months before the exam. If you do that, then even 3 months, as I told you, like what I took to just the exam, that is more than enough.
Because as much as I know you were right there from the beginning. We all used to study. We were sincere about it. So it's like if you are sincere enough from the very first year, if you are just doing your college studies or your PPTs and maybe your books and all, with that 6 months of preparation is just enough. If you have that kind of history, right?
Definitely, you can definitely get through.
Okay, so next question is Bhargav, that what would you suggest to our juniors, medicos, who are just about to enter or have just entered the medical college? How should they go about their studies? Shall they keep these exams in their mind, or simply focus on studying subjects properly right now? So what you will tell them?
Okay, yeah, that's a good question. The reason being, as you know, from the past 2 years, all the exams have become clinical oriented. So you don't see one-liners now, you just see clinical vignettes in the exam. So you're given a case history, and then you have to make a diagnosis, and then you choose the right answer. So what is the importance is that you need to clinically correlate the things with what you're studying, even if it is anatomy or something. Even subjects like anatomy or physiology, it doesn't matter which subject it is. You need to look at what diseases you're going to see, if there is some abnormality, and then try to correlate things between different subjects also. That is also important. You just cannot study one subject separately and think that, okay, so I finished this subject and let's move on to the next subject. It's better that you don't divide it into different subjects. You need to start integrating concepts from different subjects. So for example, if you're studying, let's say, pneumonia, you need to study about the pathology of pneumonia from pathology, and then the pathogenesis, pathophysiology from medicine, and then the drugs which are used to treat pneumonia, that is from pharmacology. So that's how you integrate different subjects and go about a topic. That's very important from the beginning. And I think the more you're good at integrating things from different things, like trying to correlate stuff, you will be better clinician as well, and definitely you will be able to ace your exams as well.
That's true. Well put, Bhargav. So many FMGs ask this also, that they are not able to remember what they study, especially in subjects like pharma, NET. So what would you suggest them? Or let's look at this question this way. What are the 3 most important things that you would suggest somebody who is in first, second or third year of their medical college life, where to focus on? Books or any online platform, or making notes? What should they do?
So I think they should do whatever they are most comfortable with. Like if someone is comfortable with making notes of his own, then I think he can go about with that. After one studies a particular topic from a source, they need to start solving questions related to the topic. That's how they can test their knowledge on that one, and even they'll be able to remember things better. Because once you make a mistake while solving a question, let's say, you are going to look at the question where you went wrong, and then you may note it down, whatever the mistake that was, and then come back and revise the same topic. So that's how you start building that gap wherever that was created before, and you'll be better at remembering things in that way.
I mean, all of us go through this, we tend to forget everything, and basically you should think it like this, that you won't be able to do it in the first go. The revisions are must. You need to revise them thoroughly again and again. All right, Bhargav.
So what I suggest is they go about their first reading, and they understand different things. Try to understand as much as possible in the first reading, and then they come back for the second reading and definitely the subsequent revisions, where the concepts will become much more clearer. So definitely they'll be able to remember it for a longer time.
That's true. FMGs, we ourselves are FMGs, so we know that time is sufficient as well if you prioritize your time. We can say like this, because we tend to think, okay, we are foreigners, we have to cook food and so many different things we have to do. We don't have time. What's your take on books? How should we go about it?
Yeah, supposingly if a student is not in his final year, or he is not during his internship, then I suggest that they first go through the books and then start something more specifically related to the exam. Because once they are in the internship or in the post-intern year, they don't have time to study textbooks from the beginning.
Right.
So before that, that's the best time to read the textbooks, because you don't get everything in the exam preparation material. So they need to focus on the textbooks from the beginning itself.
You must have a thorough knowledge and then go for concise knowledge. At first, at least, build your foundations like that.
Right, and then they can summarize things from the textbook and then revise it.
Right. So that takes me to the hot topic these days: online platforms versus offline coaching centers. So, what do you prefer, and I mean, why? Like that.
So, actually, it doesn't matter which source you study from, be it Marrow or PrepLadder, DAMS, Bhatia, etc., etc. It depends on you, basically, how you study, how many times you revise, and how many MCQs you have solved, actually. So, given this current pandemic situation, it so happens that there are very few offline classes right now. And if there's a new wave, then once again they're going to shift back to online mode. So I preferred online mode for the same reason. And even during my internship year, I was not able to attend any physical classes, and I preferred online mode because I can study at my own pace, and I don't have to sit for 10 or 12 hours in a room and listen to the lectures one at a go.
Yeah, at a go. We can choose to study whenever we want according to our schedule. And that's all right, Bhargav. So let us now deep dive into your preparation strategy. So how did you divide your time between videos, notes, and GTs, and how many hours a day were you studying?
Okay. So how I used to study was, first of all, I used to choose a topic, and then I used to look at the videos. And since we had basic knowledge of things, I used to watch videos at 1.5x or 2x speed. So that's how I was able to complete them faster. And immediately after looking at the videos, then I used to go through the notes, and then you need to solve the same MCQs related to that topic. That's how I was doing it. And when you're close to the exam, like 4 months or 6 months away from the exam, I think minimum of 8 to 10 hours is definitely required. And as you go closer to the exam, I think more revisions are required. So
Right.
I think 10 hours average is good enough.
10 hours. All right. And regarding videos and question banks, were you solving question banks the very same day or next day?
Yeah, immediately after reading the topic, I used all the questions so that it sticks with me for a longer time.
Right. And when do you used to revise them? Like some people say revise the next day what you studied previous day. Some say better after a week, so that when you start forgetting, suddenly you revise them back again. So what's your revision? What was your revision strategy?
It depends on how volatile the topic is. So certain topics like pharmacology or anatomy, it's easier to forget those things. So I preferred revising it like after a gap of 1 or 2 days. But for those topics which I was more confident or more thorough with, I would leave it like revise it after 10 days or even 2 weeks.
Right.
Depends on how confident you are with the topic or how volatile that matter is.
So it's more like you must understand yourself, where you are at, exactly, and where you are going.
You should know your weaknesses and strengths.
Yes. If your subject, certain subject or certain topic of that subject is weak, better revise it soon enough. And if you are thorough with something, you can choose to revise it later, like that.
Longer interval.
Yeah, that's wonderful. Okay, Bhargav. So next question was, what all resources were you following? Like from online platform, you said PrepLadder, but anything else, or to any Telegram group, any notes material for question banks or MCQs, any other book, like people go for FMG solutions and those kind of books. So what were your resources?
Yeah, as I already pointed out, we need to stick to one source for studying the topics or the notes, especially. I think MCQs is fine. Whatever platform on which you are studying, they definitely have the question banks. And if you still have time after solving those questions and you think you need an extra edge or something, then you can go for various MCQ books. Many of them are available on the market. So it depends once again how confident you are and what is your level of preparation.
All right. So to all those who are planning for upcoming exams, what are those things that according to you they must avoid? You know, any mistakes of yours that you don't want them to make, and this is really like this is going to be, I'm sure, very important for them.
So mistakes, I would say that you need to solve as many MCQs as possible, and grand tests. Those things are really important because it gives you a actual feel of how the exam is going to be. Because in an exam, you have the first session and the second session, and you need to sit for 2.5 hours straight during each session. So when you take those grand tests, you get a feel of it, and you have to sit in the same place for 2.5 hours. And that's very important.
Right.
It's a practice just before the exam. So you need to start taking those grand tests. Many people say, I'll start taking grand tests after I complete studying everything. And that day probably never comes actually.
True. It won't come at all.
It doesn't matter how much they have studied. It doesn't matter how much they score in the grand tests. They should start taking the grand tests just to get a feel of it. That's important.
Like prime yourselves up for the exam. That same scenario, and even you can compete with the all India competitors, so you will get a clue where you are, like that. Right. True. Okay, Bhargav. So regarding this question, I was getting a lot from some of our colleagues and juniors. Were you adding qbanks information into your notes, and were you making notes at all? What's your take on note? I mean, you have put it very brilliantly in one of the questions previously, but like focusing more on notes, what's your take on that? And what were you doing?
Yeah. So I didn't make any separate notes apart from whatever platform I was studying from. But what I was doing is, if there was something new, let's say I'm solving MCQ and I haven't studied that part before, and then after I solve the MCQ, you have the explanation part from the answers.
Right.
And if that's a new concept, then I used to take a screenshot and put it into subject-wise folders, so that since it's a new topic, by the time I come back and start revising the subject, I would have to go through the screenshot once again because that's a new topic for me. Apart from that, handwritten notes, no, I didn't have any handwritten notes.
So, next question I would like to ask you in different scenarios, because some people might have a significant time left with them to study, and some might not. There are only few months left for June 2022 also. So, let's say what subjects you would say one must do before exam if they don't have enough time to do all the subjects. And next question is to someone who have just 2-3 months and can't do that as well. So what would you suggest to them? Is rapid revision enough for them? So these two questions separately.
So regarding the important subjects, I would say the big four. I would call them as the big four.
Right.
With medicine, surgery, pediatrics, and OBG. And if you get through that, that means you have got through a big chunk of your exam also. Questions also in terms of the number of questions, and even pathology. Pathology is also quite a big chunk. So these are the most important ones for the exam. And if at all they don't have enough time left with them, then as you said, revision videos are good enough, provided they have built on their concepts from day one.
True. This is important, right? You must have that foundation, that concept you must have before going for this running behind this rapid revision courses, because otherwise it will just go over your head. You won't be able to remember anything, which is the most important thing for this exam. You need to have the recall value. So okay, that's well put, Bhargav. So how did you divide the time between subjects? I mean, did you study according to the weightage of subjects? If yes, then which subjects were on your priority list? Or did you go, like you said, in an integrated way because you only got 3-4 months? So how did you go about these things?
For the FMG exam, I didn't go for integration manner because of the lack of time. So I knew what topics were important, which subjects were more important. So as I told, the big four and pathology, those were the most important things. And I still had some time left after that. So I did the smaller subjects, which are like quite easy to get through. For example, PSM. So you get 30 questions and it's quite easy to score them actually. Even forensic medicine, psychiatry, these are also good enough to push yourself above that 150 mark.
Yeah, somehow do that magical mark thing. So you meant to say the big four: medicine, surgery, pediatrics, obs, gynae, and then you can also go for patho, PSM. So this, if you don't have time, and if you do this, you can take a chance on your luck as well, like that.
Definitely. Yes.
Okay. So Bhargav, during the last month of your preparation, did you add anything, or did you change your strategy in some way? Because that is the pressure cooker situation. So what was your strategy in the last month?
Yeah, during the last few days, what I did was I didn't study something new, which I had never known before. What I did was I tried to revise what I already knew, and I think that was the most important thing. Because once you start reading new concepts once again, then you have to revise them. Otherwise, it's once again it's a volatile thing. You may forget it. And I just went on the same thing, like videos, notes, and MCQ.
The follow-up question just before the exam, 3 to 4 days. What was your strategy? Were you, because why I'm asking this question, because some juniors have asked me. There are a few chanting videos that goes around on YouTube. Many platforms add their own MCQ marathon kind of video. So at the last few days, there is a lot of suddenly there is a overflow of information. So the last 4 to 5 days, what should you do, and what you did?
Right. Yeah, I have seen those things like must know concepts or very likely questions appear. Yeah. These kind of questions will start popping up here and there as the exam day approaches. So I feel my personal opinion is you don't have to start looking at each and everything, because once again it's going to derail from your path.
True.
And you need to remain calm and stick to whatever you were doing these many days for your preparation. And most importantly, even 2 days or 3 days prior to the exam, don't start anything new, don't start any new subject if you haven't finished things. Try to revise the things which you have studied, and most importantly, where you feel you are somewhat lagging behind, or you feel those things are tough for you to remember, just revise those things. Don't do anything new before the exam.
The last few days you need to be laser focused. You need to have that tunnel vision, because right now
Right.
there are a lot of things going on. This is the time when you focus on what you are doing, your strengths, and better just revise them and leave it up to the Almighty maybe, and
Yes.
your training, whatever practice you did. So okay, well put, Bhargav. Okay, so Bhargav, next question is naturally we all get anxious, we all get nervous for the D day, for the exam day, and plus the uncertainty of the FMG exam lately. What are your tips for them to follow on the day of exam and at exam centers? So if they see, difficult question in the exam, how to keep oneself calm and collective at the time?
Right. It's very natural for one to get anxious and psyched on the exam day. You go to the exam center and you see people are discussing things, people are discussing questions with each other, they're revising topics. So I would say try not to focus on those things, rather focus on your upcoming exam, and don't listen to those things what they're discussing, because once again, if you don't know what they're discussing, you will naturally get stressed out. So try to stay away from all kinds of discussions right before the exam. That's important, I feel.
Next question is for our colleagues, our juniors who have already given a few attempts, and this is their maybe second, third attempt, and they are already stressed out. So what should they, because they already be knowing their strategy, what should they do mentally? How to go about it mentally.
Right. So if they are in the second attempt or the third, or it doesn't matter, any attempt, they would know by now what are the strengths and weaknesses. So I would suggest that they work on their weaknesses. For example, if you feel medicine is a weak subject, then they should go back and revise medicine, solve more questions, clinical oriented questions, and your strengths are there, so you revise on those, you make those strong points. You need to stay motivated by considering what are your strength points.
Yes.
And then focus on working on your weaker points. So at the back of your mind, you yourself will get motivated saying, okay, last time I didn't work on these weaker points and right now I'm doing it, so I have a better chance of clearing the exam.
True.
And that's how they can go about it.
Yeah, you are. That's what I kept saying them. You have an advantage. You already gave the exam. You are used to the scenario, the everything. So use it to your advantage, and don't worry about all these things much. It's just about one exam. You pass it, and you are through. So nobody is asking you how many attempts you gave or something like that.
Right.
True, Bhargav. So since you already completed your internship right now, Bhargav, and a few days ago, and how would you suggest someone to study in such a way that it not only helps them with these exams, next screening is coming, but also during their internship?
Let's say that you are right now in your pediatrics posting, and I suggest you start revising your pediatric subject at the same time, so that let's say you are having a case of maybe dengue in your ward. So look at the criteria for which, how do you diagnose dengue, what are all the lab workups that you do, and then you go to the wards and look and read the case files, case history. Try to, if at all have any doubts, then you can definitely get back to your postgraduates and your professors. They'll be willing to help you out. And try to look at all the patients in the wards because you may find some clinically interesting cases, academically interesting cases, which is quite rare. So it's a very good opportunity. So I would suggest the same subject, whichever postings you are in, try to do the same thing. That will be helpful.
Even medicine, right? It is of 2 months.
Yes, medicine postings is for 2 months. So we'll have psychiatry in the same posting. 2 weeks of psychiatry. I think 2 weeks you can actually you can complete the psychiatry subject in 2 weeks along with your clinical postings. That's how you should do it. Medicine is a vast subject. Try to do a lot of physical examination on the patient, auscultate different murmurs, find interesting cases.
So when you are studying, study it in an integrated way, as you said. Do it from the same topic, from the pathology, from the physiology, patho, then medicine. And if you are doing anything from surgery, you must have a coordination with anatomy and other subjects. And then when you are in internship, try to communicate as much as possible with your postgrads and your seniors, and try to be more interactive. It's not like you need to consider yourself as a foreigner. So better you first communicate and then try to learn it in an integrated fashion. All right.
You need to show interest. You need to show interest in the hospital or in the wards. So try to learn as much as possible and ask as many questions, and you will definitely get your answers because you have a very good practical exposure.
So finally, Bhargav, it's my favorite question. How did you used to keep yourself motivated? It has been extremely tough years for everyone. This 2 years, and how to stay motivated during this time and keep executing at our plans and strategy at the same time with full power. So what you used to do?
I think the key to the thing is you need to know what you want at the end. You need to know how badly you want to achieve a goal. You need to have set timeline that I need to clear the exam my next attempt or my first attempt or whatever it is. Let's say you are in your final year, so you have 6 months or something to appear for your exam. So you need to have set timeline goals, and that automatically will motivate you to achieve your dreams, to go behind your goals. And I think you need to stay motivated more from internally rather than your outside source, somebody motivating you that you have to do this, you have to do that to achieve this. If it comes from within you, then I think you can definitely do it.
Right. So
no matter how difficult it is.
Yes. So that you need to know your why. Why are you doing what you are doing, basically, and rather than going for 5 or 10 minutes motivation video which will boost you just for another 15 or 20 minutes. Find out it within yourself, the reasons that you want to achieve them, what naysayers told you, and how can you prove them wrong, and all those things, and be driven internally. Right, Parth? One more question was there, since it's a no-all interview. So once again, just for the sake of emphasizing, the resources that you followed basically for the 3 months were for online platform PrepLadder, but you can choose anything you want based on your time that you say. But you chose PrepLadder. Question banks from the same platforms. Okay, and books. While doing your medical in your medical college years, you went through it. You studied books thoroughly. And when the time came, you went for a concise version. All right. And any other review books did you follow? Any other so many concise books and essence books? So anything else you want to add it up?
I think for FMG, don't go for multiple sources. Okay. Choose one platform and stick to it. That's more than sufficient.
Okay. So this is their question. That how much the content thing, how much is enough for FMG? Like is one platform which has a little bit concise knowledge, is that enough, or where there are too much of information, is that enough? So this is their one big question, that how much is enough for us to pass, because there are so many things. Right. So what would you tell them?
Once they choose a source, I think they need to be confident with that source, because the people who have taught you in that, they know how much is sufficient. So just stick with them.
Respect them at least.
Yeah. Right. You don't have to doubt them, thinking if this is sufficient or this much is enough, or should I go to something else. That's how you start wasting up your time and start deviating from your path.
True.
So I think the people who taught you in that platform, they are the subject experts.
True.
And I follow them. It's definitely enough.
Yeah, but more than staying with them or having trust in them, you must respect them. They are there for a reason, and if they are saying this is enough, then that is enough.
There are no hard and set boundaries saying that this much is sufficient, that much is insufficient.
Right. Okay, Bhargav. So I thank you so much, Dr. Bhargav. Now we are doctors, and for your amazing answers, and I'm sure it would solve doubts of majority of our colleagues and juniors. And I must ask you, how can our juniors or colleagues contact you in case they have any more doubts? So,
you can find me on Instagram.
Okay, so your ID?
Username Bhargav_Ganapathi. You can find me.
I'll post it up there, so you can directly click that link. So thanks a lot, Bhargav, and I wish you all the best. I'm always with you in this endeavor, in this medical struggle that we have been going through, and we will go through for the next few years. So all the best, and I am sure you will do wonderfully well wherever you go. So thanks a lot.
Thank you.
All right.
Best wishes to you.
Okay. See you.
Be strong.